Hi, my name is Lamisha Lindsay, and I am a therapist at Vancouver Wellness Studio. I specialize in trauma using EMDR therapy and neurofeedback. And I've been asked by a friend and colleague of mine at Vancouver Wellness Studio, Crystal Myers, to answer some questions related to chronic pain and chronic pain in COVID. And so the first question she asked me is, how do you approach chronic pain? I would say I approach chronic pain with curiosity. I'm really interested when the clients that I work with are exhibiting chronic pain, that I really want to get to know the story of the pain. I want to get to know the message that the pain holds, how it fits with the client's life, how long the chronic pain has been there. I want to get to know with curiosity, the what the role or the job of the chronic pain is for the client, what message they may have for us, and for the client in their life. So really approaching pain with curiosity. Some chronic pain may be part of the body telling its story and holding experiences from the past, either old injuries that clients may have, if they've experienced something like childhood abuse. Chronic pain can also be flashbacks, so some unresolved, unprocessed memories or experiences. And not all chronic pain may be related to trauma experiences, but it can certainly traumatize somebody to have chronic pain, and having to deal with the ramifications of chronic pain can be traumatizing for clients as well. So I try and get to know that story too. How are you seeing the impacts of COVID affecting your clients with chronic pain? I think COVID, is impacting all of us, but I think that because we have not ended this time of threat with COVID, and we have not come to a place of safety where the threat is over, I think our immune system and our nervous systems are on alert in that fight, flight, freeze sort of response. And so I think people are bracing, they're holding their breath, they're more sedentary, they're not receiving the nurturing, the hugs, and the closeness that maybe they would be getting if they weren't so isolated. And so I think I don't think we know the full effects of chronic pain as a result of COVID until after we've entered the safety period, until after COVID is over. And so I think it's exacerbating people who already have chronic pain, and I'm curious as to see what how people's bodies are going to feel after COVID is over, and we may experience more chronic pain, just like we're experiencing more mental health issues as a result of COVID. And perhaps when it's over, we might see more than we even are seeing now. What have been some of the most successful approaches you've used in lessening and preventing chronic pain? Well, with EMDR therapy, we target pain, the pain experience. So when the person was injured or when the chronic pain began, we can target medical issues, procedures, surgeries related to the chronic pain. We can target the trauma effects of going to medical professionals and maybe not getting the answers, or not having information about why they're in pain or what's causing the pain. We can target current day experiences of living with chronic pain, how that impacts a client's life. I also use neurofeedback, which works with the brain waves, how people are feeling emotionally as well as physically. And we can use sensors to the head, but we can also put sensors on some parts of the body that can help to reduce the extent of pain. And let's see, what inspires you about this work? What inspires me is helping people to be able to live a more full life with pain, whether they're using mindfulness in order to learn to be with the pain in a way that they can just sort of observe it, ebb and flow without judging it, or being compassionate to themselves using compassionate practices, some loving kindness to themselves and their bodies while they experience pain. I also am inspired. I use some internal family systems and work with parts of self and do some deep healing around the stories and the messages that pain holds for us. And so I'm inspired by how people can live a full life even if they are experiencing chronic pain. What do you feel is the most important thing for people to understand about chronic pain? I just really encourage people to not isolate chronic pain as just a medical issue, but also know that a good extent of it is also connected to our emotional health and our mental health and well-being, to seek out support from practitioners, body-based practitioners, that our heads are connected to our bodies, so we need to really treat the person as a whole person. So connect to massage therapists, acupuncturists, to have counseling support, to use some trauma modalities, and just to not give up, to keep asking for help and letting others help you on this journey. All right, thank you for listening today. If you have any questions for me, you can reach me through our website at www.vancouverwellnessstudio.com. Thank you.